stroke, heart attacks. The person can become blind. But what we are seeing more common is this type 2 diabetes. Hi, I'm Dr. Sanmuga. I'm the internal medicine physician here at Hospital Taiping. So my role in Diabetes Malaysia, this is actually Diabetes Malaysia Perak Taiping Branch. So I'm currently the president of this Taiping branch for the past 1 year. So the reason why I'm in this society is I noticed that as a doctor, when we are treating patients, especially diabetes patients, it's not only about the doctor's efforts. It's for diabetes to be well treated. It's more of the patient effort and also the family members. For this, the patient and the family members need to be aware of their diabetes, what is diabetes, and how to manage this diabetes. Then I found out that there's such society that can help patients and overcome their questions and challenges in managing diabetes. So that's the reason I joined this society. So diabetes itself can be divided into type 1 and type 2. So type 1 is usually a genetic reason. So they start to have this diabetes when they are very young, children age. But what we are seeing more common is this type 2 diabetes. More of these type 2s are more related to our lifestyle. A lot of younger generation now are having sedentary lifestyles, and also about their diet. Our diet are more of a lot of sugary diets, a lot of carbohydrates, and a lot of calories. So combine that with sedentary lifestyles, the younger generations are prone to get type 2 diabetes earlier. So one of the common misconception is that whenever people hear about diabetes, they always think that you need to be on insulin. They need to inject insulin, so they are fear of the needle. So not every diabetes patient needs insulin. Different when you are talking about type 1 diabetes, which occur in children. Type 1 diabetes, yes, because they need insulin. But what's happening more common in Malaysian population is type 2 diabetes. So type 2 diabetes, there are ways to manage it. And of course, not every patient needs insulin. There are medications, lifestyle modification that can be given, as well as insulin. You most probably will need insulin only if your diabetes is poorly controlled. Tell about one of these patients. He's a lorry driver. He initially was diagnosed with type 2 diabetes mellitus, which was poorly controlled. So in diabetes, we look at the level of HbA1c. So his HbA1c was 12, which is very bad. So he will require insulin. But looking at this lifestyle, he's a lorry driver, so he doesn't have a proper meal time, and he can't really be taking the insulin, because when you take insulin, you need to on time. So he was having this difficulty to manage his diabetes. Come to our societies, did a bit of counseling. We advised him how to adjust the lifestyle. For example, started him with just one injection of insulin, a combination of other oral medications, and we asked him to set a reminder on his phones so that he will remind him to take the insulin and oral medication, and advise him to set a reminder to eat on time with a proper diet control and exercise. So over time, after a few years, from the HbA1c of 12, managed to bring down to HbA1c of 8. So, and then the insulin was slowly stopped later on. So this is a very good response over the years if the patient can follow what the doctors advise. And he need to put on some effort to change their lifestyle. So what I've seen is that university students, they are also having a lot of sedentary lifestyles. I think common among teenagers now is all the sugary drinks like boba drinks and all that. So remember to see what you are eating. Always count your calories. Always look at the nutritional values of each food. Look at the amount of sugars you are taking daily. You also need a regular exercise. So if you're taking too much of sugar and you don't exercise, probably you will get diabetes in a few years' time. And I do recommend a regular health screening. Probably can start as early as when you are going to university, they will do a health screening. So do check your bloods for diabetes. So early screening is very important so that we can start the treatment early.
Diabetes has no age. Even young people are at risk. That's why awareness, early screening, and a healthy lifestyle with regular exercise are important. Through We.R.Wira, we highlight Dr. Sanmuga from Diabetes Malaysia, who raise awareness, conducts talks, and support patients in the community. Take action today because prevention starts with you.